Good evening, everyone. My name is Nita Gombakomba. I'm a rising fourth-year medical student at the University of Maryland School of Medicine, and I have the privilege of serving as the National President-elect of the SNMA. Welcome to the start of our Sowing Seeds Specialty Series, and this week we'll focus on surgical subspecialties. This series is a part of our Sowing Seeds program created during the pandemic and continued by our National President, Chantel Thompson, in collaboration with the Alumni Affairs Committee. Throughout this year-long program, we will provide resources on how to succeed as a pre-medical and medical student, and we'll touch on everything from financial literacy to preparing for board exams and more. So make sure you're a national member by visiting snma.org and signing up to stay in the know. Tonight, we have 5 amazing and inspiring panelists who are excited to talk to you and answer your questions. First, we have Dr. Erin Dotson, an ophthalmology PGY2 resident, Dr. Anita Brown, ophthalmologist at Thomas Eye Group, Dr. Asia Matthew Anabanjo, PGY1 Urology resident, and Dr. Ashley Matthew, PGY2 Urology resident. Thank you all so much for joining us. So next we'll go ahead and introduce our panelists. So first we'll start by hearing a little bit of everyone's personal stories. So you can talk a little bit about where you completed your medical training, where you're practicing now, how you came to choose your field, if you had any mentors, and things that you really like about the field. So whoever wants to go ahead first.
I guess I can go ahead first here. So good evening, everyone. It's always an honor to be here. I truly love and adore SNMA, Student National Medical Association. I would not be where I am today without SNMA as well as the NMA. My name is Dr. Erin Douglas Dotson. I am born and raised from Inglewood, California in the Los Angeles area. I then went to college at the University of Texas at Dallas, where I studied neuroscience and classical piano. I then went on to complete medical school at St. Louis University School of Medicine, and I'm now a PGY2 at the University of Iowa for that of ophthalmology. So ophthalmology, many of my friends who know me, they know I can go on and on and on, talk about how much I love this field. But what drove me into the field was that it is the perfect combination of primary care medicine in addition to surgery. I discovered ophthalmology very late in my medical school career, like many of people, because we do not really get the best education when it comes to the eyes from many of medical schools. So in my third year of medical school, I did a random 2-week career exploration elective. And from day one, I realized how much I loved it. As an ophthalmologist, you are a clinician. You are the surgeon. You are a pathologist. You are the radiologist. You truly do it all. And there's so many different subspecialties within this field, and there's such a need within this world. I mean, additionally, a few other perks is that ophthalmologists, we truly are some of the happiest surgeons. We have an excellent, wonderful lifestyle. But the biggest thing we want to stress to you guys tonight is the need for more Black and brown eye surgeons in this country. The later generation of Black and brown ophthalmologists, they're retiring actively, and they are actively looking for more people to fill in those positions. So if you are interested in ophthalmology, even just the slightest bit, we have the information, we have the resources ready for you guys tonight. So once again, thank you so much for having me.
Thank you so much, Dr. Dotson.
So I am Dr. Brown. I am a board certified ophthalmologist. I practice in Atlanta, Georgia for the Thomas Eye Group. I'm also from California. I went to college at Spelman College in Georgia Tech here in Atlanta. I was a math and electrical engineering major. I then went to medical school at the UCLA Drew program. And after 2 years of medical school, I decided I wanted to do graduate school. So I applied and I got into Duke. And I finished medical school and my PhD at Duke in biomedical engineering. I did my residency at Howard University in DC, and then went back to Duke and did a glaucoma fellowship. So I am a glaucoma surgeon. The reason I chose ophthalmology is because I wanted to take care of Black folks. I wanted to be able to treat and do surgery on patients that look like me. My biggest influences were probably during my residency at Howard. I was able to work under Leslie Jones. And I also was able to do a program called the Rad Venable program. So for all of you aspiring ophthalmologists, as the NMA section chair, We sponsor you guys to come to the NMA conference every year. You can come as a spectator or you can come to present your research. And I really appreciate the SNMA giving us this platform to talk about ophthalmology. Thank you, guys.
Thank you very much, Dr. Brown.
Hey, everybody. My name is Dr. Ashley Matthew. I am currently a PGY2 at VCU Urology. I went to Xavier University of Louisiana for undergrad, where I majored in chemistry. And then I went to the University of Massachusetts Medical School, where I did their MD PhD program there. And then I graduated in 2020. And now I'm really excited. I love VCU. I'm having a great time. Urology is amazing. I think every surgical subspecialist is going to say that their field is the best, but urology is definitely one of the best fields out there. It's a surgical field that's dedicated to the medical and surgical care of the female and male genital urinary tract, as well as the male reproductive organs. So we get to do so much, from very small procedures to big oncology cases, to infertility, and get to help people have, men have babies, with male infertility factor. It's such an amazing field. And I love every single minute of it. I love water cases with endourology. As a PGY2, I'm at VCU, we're starting to do more operative skills and, being in the operating room so much more and learning some new things every single day. And it's so much fun. I absolutely love it. Urology is a phenomenal field because you get to do so much. There's so many surgical, divisions within urology. So you really get to tailor it to the type of life that you want to live. Residency is really busy as a surgical resident, but once you get out into practice, you can really tailor it to what you want to do with your life. And so I'm super excited. I'm really excited to be a PGY2. I have fun on a daily basis. I love my co-residents. We have like a really good time, and I'm really, really excited to be here with SNMA. I love the SNMA. Like Dr. Dotson said, I completely agree. I wouldn't be here without the SNMA and all the support I've gotten from the SNMA. And so I'm super, super excited to be on this panel and discuss with you something that I absolutely love. So I'll just leave it at that.
Awesome. Thank you so much, Dr. Matthew. And before I move on to our next speaker, I just wanted to let you all know that you can go ahead and drop your questions in the chat.
Hey y'all, sorry, I have my 2-year-olds with me. I'm Dr. Asia Matthew Anabanjo. I'm a PGY1 at UNC Urology. It still feels pretty new because it's only been like 3 months, but I'm loving it and learning a lot. I am Ashley's twin sister, so my story is very similar. I went to Xavier University of Louisiana. I studied chemistry, then went to the University of Massachusetts Medical School for the MD PhD program, where I studied cancer biology. And then I decided to go into urology. I think, like Ashley said, urology is a field that has a wide breadth of things that you can do, from the big cancer cases all the way to really small cases. And you can really tailor your lifestyle to what you want to do in it. The other thing I really loved about urology is it's prime for a lot of research innovation. And as a MD PhD, you really want to go, for me at least, it was important to kind of go into a field where I would be able to actually tailor my PhD and my research interest. And I think urology really allows you to do that. Actually, a lot of the surgical specialties probably allow you to do that. And then just being with the urologists, they were the most fun people in the hospital to me. You're able to talk about sensitive subjects and still laugh and have a good time and, make people feel good about really sensitive topics. And I think being a part of that is really amazing. And I'm really happy, again, that SNMA has had this platform for us to be able to talk about our specialties and really get more Black surgeons. We need them. It's a known fact that we're very sparse in the field. And so the more that we can have and the more platforms we can talk about how great these surgical subspecialties are, I'm really happy to be a part of it.
Awesome. Thank you so much, Dr. Anabanjo. So the next thing I just wanted to ask all of you, can you talk a little bit more about the role of mentorship in how you were able to get to where you are and kind of navigate, your career? You kind of talk about how important that was to you and when you started seeking mentorship, and if there's any, particular individuals that helped you through your process.
Perfect. I can talk about my mentor, or sorry, I can talk about my mentor. So I actually, before I got into medical school, ever since I was a little kid, I was a nerdy, geeky, nosy little kid. I would always accompany my mother to her doctor's appointment. And her doctor was a black male physician. His name was Dr. Gilbert. He was the very first black man in the white coat that I had ever met. And because I would always have these questions for him, it got to the point where he was like, well, Aaron, since you have all these questions, why don't you come and shadow with me? And since then, as being a little kid, that's what really helped to establish that relationship, to let me know that, yes, Aaron, you can become a doctor. There are doctors who look like you, and there are people who are willing to put in the time and the effort and to work with you to get you into medical school. So even from a young age, I felt that mentorship is absolutely essential, absolutely important. In medical school, I found a lot of mentorship through the National Medical Association, the NMA. So as I mentioned, I was late in applying I was late in regards to experiencing ophthalmology, but I was very blessed to attend the Rab Venable conference that was in Honolulu, Hawaii back in 2019. And at that conference, I got to meet so many other minority eye surgeons who are on faculty and such from all over the country. And that's where I was able to establish mentors who were current residents, who were current fellows, as well as attendings and faculty. And it was at that meeting where I met my program department chair, who's Dr. Keith Carter. He is a Black, world-famous oculoplastic surgeon. And I told him, I said, I'm very interested in Iowa. I want to learn more about the program. I want to go in oculoplastics. So since then, and meeting him at the conference, I've been able to, continue to establish that mentor-mentee relationship with him. I mean, I'm very blessed to be here at the University of Iowa, and I look forward to doing the same for others who are also interested in the field of ophthalmology with regards to mentorship and just helping them. Because, someone else helped me, so I feel like it definitely is my obligation, my duty to do the same for others.
I definitely echo the same sentiment. Mentorship is so important. At my medical school, Asia and I, we had like a very good pediatric urologist. And, I didn't really jump into this when I introduced myself, but like part of the reason why I went into urology was because of my pediatric urologist mentor, Dr. Ellsworth. She was amazing. She took like a lot of interest in my twin sister and I, and, really got our feet wet in what surgery was like, especially pediatric surgery. So that was so much fun, and I enjoyed that. And now, even as a urology resident, I have so many mentors, especially to have, Black mentors has been great. Like, AC, Dr. Ching King. I'm trying to think of all their last names because I'm on a first name basis with all of these people. Our friend Joseph, he's like a brother to me. Jojo, he's great, and he went to University of Minnesota. These are residents, and they took a lot of time to support us and give us advice about the whole interview process and applying, getting our application together. And so I try to do that now. I'm happy to mentor anybody who would like to go into urology. If you have any specific questions about urology, how to get there, what do I need to do, how to make my application stand out, Dr. Matthew, can I practice interviewing with you? I'm happy to do it because I'm rooting for everybody, Black to get into urology, because we really do need, Black urologists to take care of our people. A lot of things like prostate cancer, Black males are afflicted with that, and having a Black urologist, they might feel more comfort and support and want to actually follow up in their care so that they don't develop this metastatic disease that's terrible, So mentorship is highly important, and I've had so many great mentors. Dr. Millhouse is another mentor. She's great. All of these wonderful people, Tola, they all have supported us in so many different ways, and us as in my twin sister and I, and I'm really excited to give back, and I try to do that on a regular basis. That's why I like to participate in things like this.
I definitely have to say, everybody's going to echo this, but the one thing I say about mentorship is it's actually more than mentorship. We need to focus on sponsorship. It's not enough just to, talk to somebody and get guidance, but you need to find that person that's going to be talking about you behind closed doors to get other people interested in you. And I think that's like the direction that we should start heading in, is instead of thinking about mentorship, is really focusing on the person who's going to sponsor you. Those Dr. Millhouses, those Dr. Moseses of the world, the Dr. King, those are the people in urology that, I look forward to talking with. And, I think that they definitely talked about me behind closed doors. So I feel like I am where I am today And even my other mentor, Dr. Angie Smith, who's at UNC Urology, these are the people who were, behind closed doors during my application season, hopefully talking about my application and helping me get to, where I wanted to go. And, they didn't care that I didn't want to go to their program. They just wanted to help me get to the program that I wanted to go to. And I think that's really important. And that's, the start of me getting into urology was because of Dr. Ellsworth and the people that she talked to about me. So, we got to move beyond mentorship. It's really about getting that person who's going to talk about you behind closed doors and really get other people excited about what you offer and what you bring to the table.
So on that note, I think the reoccurring theme in all of these subspecialties is that everyone is very, very smart. So we have the creme de la creme already. So the way that you're able to get into these residency programs is about people kind of speaking up for you and knowing you and validating your application. So it's not just how smart you are. And I think a lot of pre-med students, getting into medical school, if you get good grades, if you do all the things you're supposed to do, you'll get in. But with the subspecialties, it's also who you know. And that's why we have the program like Rab Venable, so that you can directly meet sponsors. You can directly meet mentors, because someone needs to be able to make a phone call for you and say, I think that this person would be good for your program. The programs are so small. Some of these programs in ophthalmology only have 2 or 3 residents, so they can't really take a risk on somebody that they don't have a personal sponsorship or a personal mentor that they can contact and talk to.
Awesome. Thank you all so much. We have one question in the chat from Alex, and the question is, how did you find those people as medical students, the sponsorship people who went to bat for you?
I say SNMA is a great start. You have so many people at your disposal in SNMA. We have the alumni affairs that can get you in contact with people who have graduated from medical school who were participants in SNMA. I think all of our stories, and that's why we're here tonight, is because SNMA was a big part of it. This is kind of where you start. I think one of the best things you can do from tonight is all of us have left our personal information on the screen for you to see. And, we don't just leave it lightly. We want you to contact us. I think for every panel I've ever been on, I always say, I didn't just leave this here because I don't want to help you. And at the end of the day, nobody sends me an email from it. This is like, free advice and guidance for you to tap into. And all you have to do is just take the initiative to send an email that says, hey, I saw your panel. I saw you speaking. I'm really interested in your field. Can you sit down and talk to me? And I'm like, yeah, let me make time in my schedule. I'm an intern. I work really hard, but I still will definitely make time for you. And all of my mentees can attest to that. And I think, this SNMA is just a great place to start.
But with specifics to your school, if your school has a program, you can always reach out to like the program director and, the program director, the chair, or if there's a certain part of a surgical field that you're interested in, they have a specialist there. You can contact them directly and say, hey, I'm really interested in what you do. Can you show me? I'd like to learn about it. And you just build a relationship. And from there, just you taking interest in what they're doing, most of the time, that's going to be enough to open the door to get in there. And I think that's what I did. I mean, I sent Dr. Ellsworth an email. I didn't know her, at all. And I was told by somebody like, don't expect to do anything in her OR. She's not going to let you do anything. But I emailed her, and the first day she was letting me help her with a circumcision. So I was in her OR. I didn't go to clinic first. I went to the OR with her. That was my first experience, even though someone told me that that would not be the case. And I just told her what I was interested in, had a conversation with her, and we just built a relationship. And by building that relationship, that was enough for her to say, hey, like, what programs are you interested in? By the time I was a 4th year applying, like, who do I know there? Let me see if I can email somebody for you on your behalf. And she did that on her own, on her own volition. Like, she didn't say, like, do you want me to email people? She was like, oh, I'm going to email this so-and-so because I want you to match. So that's all you have to do. It starts with a conversation and going out on a limb and just being honest, like, hey, I'm interested. Can I just work with you for one day? And if you like it, continue working with them, build a relationship. That's what I did. It worked out.
Awesome. Thank you so much. The next question we have from Leela is, do you have any strategies for asking or encouraging current mentors to sponsor you when it comes time for the match?
I think that's a really great question. I didn't have to ask my, mentors to do that. But I mean, I guess if you were concerned, you could just ask like, hey, I'm really interested in this program. Can you reach out to this person on my behalf if you feel comfortable doing that? That's kind of all you have to ask. It's kind of the same way you ask for those letters of recommendation. Like, will you write me a strong recommendation? You put those words in there. You're like, hey, can you make a strong argument for me and my behalf going to this program? Most of the time, if your mentor is not comfortable doing that, that's probably not a good sponsor for you. And, you should have some concerns. But most of the time, they're going to be like, yeah, sure, definitely. Let me see what I can do. Or you reach out to other people who are just going to do this on your behalf because you talked with them and they felt like you were going to be a great candidate for that program. So that's kind of what I would do. I think at the end of the day, you have to just put the initiative forward to get what you want, especially in the surgical subspecialties. You come with on a strong footing, have a great CV, then a lot of doors will open up for you.
I think the thing that I was most surprised about when I interviewed for residency was that a lot of the people already had relationships with folks at the programs where I was interviewing. So a lot of these people, there is some nepotism in these subspecialties. So that's why you have to use your resources of the NMA, the SNMA. You have to use these communities, the Rab Venable, because they're using those same communities. So don't feel, I get emails all the time. I get calls all the time. I have students shadowing me all the time. It's part of why we went into the field and why we are a resource to the community is that I'm going to get old one day. My hands are going to get shaky one day. So I need somebody to take my job, to take care of my patients the way that I do. So I think that when it comes to the match, you have to be strategic because there are people that are strategizing about this. You can't just walk into an interview and not know who you're interviewing with, not know if you even have a chance there, not know if they have a history of only taking their students. When I was a resident, when I was a medical student at Duke, there were 20 out of 100 medical students going into ophthalmology. And so I had no idea what I was doing. I just applied and I was like, I'm an MD PhD, I'm smart. But I had no idea what the game was or the landscape. And I thank God every day for Dr. Leslie Jones, who was the program director at that time and was like, we got a place for you at Howard. And that relationship just was exceptionally important to my development. I didn't even know that I needed it. And that's what I think a lot of underrepresented minority students go through is we don't even know what we don't know. And so part of this and talking to you guys is to make you aware that there's a game going on. And if you're showing up to play tennis, everybody else playing basketball. So you have to learn the new game. So that's my 2 cents. I'm old, but that's my 2 cents.
In another, place for support for urology is the R. Frank Jones Urological Society. This is a society of Black urologists, so it's a great source to tap into. They have a lot of programs for young students who are applying into urology. They have like application reviews where people will sit down, review your CV and your personal statement and all of these things. And, Asia definitely was involved with that last year and had mentorship through their URTA program. Yeah, URTA for urology with their URTA program. And it's great. I think that that's a great opportunity for anyone who's interested in urology to have access to a whole pool of people who, there's not that many of us, but we come together in a strong number, and we have a lot of different connections that you can utilize to your benefit to get your foot into the door so that you're playing on the same playing field as, the people around you who, have these connections, as Dr. Brown has mentioned.
And it's just like such a small field. I think like what we're trying to get to is like ophthalmology, urology, these are very small fields. To put in perspective, I was in the Urology program. I had a mentor. She introduced me to a person who graduated from UNC Urology, Dr. Pauline Philippou. And then from there, I met Dr. Angie Smith, who is a urologic oncologist at UNC. We had a conversation for an hour in the summer before I applied. We talked for a while on the phone, and I told her how interested I was in her program, and boom, here I am at UNC Urology. It was the program I knew I wanted to go to. And this was after talking with both Pauline and Dr. Smith. So, it's just a small world. All it does is a small conversation. That's why I say, like, you have to put the initiative in, can really take you far. It can tell you a lot about a person. Was that a little mini interview in the summer? I don't know. Did I enjoy talking to Dr. Smith that day? Absolutely. And I felt really great about UNC Urology, and I knew that that was probably where I wanted to end up during the application cycle. So, I went through the application process knowing that this was the place I was probably going to rank number one. And here I am, in my program that I ranked number one. So does that happen by chance? I don't know. I put the initiative in.
And I would say the same about VCU Urology because it was also my number one. And I sent emails, to the program. And also one of my mentors at UMass went to residency with one of the urologists there, one of our only Black faculty. So it was really cool to have that connection, and it was great. And here I am. I don't think it's by chance. I think like I wanted to go here. I made it known that it was my number one. I reached out to people who had connections to VCU because I love their program. And we've made phenomenal strides in growth. We're now taking 3 people a year, which is great. We went from 2 to 3. Any sign of a program that's growing is always like a good sign. And so I love my program. I'm very happy with my decision. And I like Asia. I echo that. These conversations were not by chance. You just have to reach out to the right people, and they will get your foot in the door.
I think it's also important for people who are worried about their board scores or who are worried about applying late. I think I got like a 215 on my step 1. And so all of you guys who feel like ophthalmology and urology and all of these subspecialties aren't options for you, we are telling you what to do. Connect with us, do some research, build up your application. And there is a way to do whatever you want to do, whatever you feel like your purpose is on this planet. And in terms of, I saw a question about submitting your application late. That goes back to having a good mentor. You need to have a resident or medical, or somebody who's one step ahead of you, right? So you guys are residents. You need to have somebody who's in their first job, one step ahead of you, who can help you strategize on how to best present yourself and to get to the next level. We all have to have somebody right ahead of us. So September 1st, yes, that's a deadline. Yes, you need to do the deadline, but you also need to contact Dr. Dotson over here and see what strategy he would say would be best for your application. You don't need to contact Dr. Brown because I have no idea, but he's a resident and these are residents on the call. So every step, we always have to have somebody leading the path because there's so many options and you're so bright that you could do anything you wanted to.
Absolutely. So if there's anyone on the call tonight who is interested in ophthalmology, if you reach out to me directly, we actually have a group me that we're utilizing for medical students as well as current residents. And it's a wonderful think tank for you to be able to reach out to others who are currently in residency and to kind of get those questions answered as well.
We have a group me too for urology. So if you're interested in that, you can definitely join the Block Urology group me and tap into the knowledge of a lot of, current residents and students who are applying and people who are just interested in the field and just genuinely want to know, what's up with urology, because it is really the best field.
And if you have no idea, join both. If you don't know what you want to do, I always tell medical students, when you're doing a rotation, play the role of whatever you're in. You know, really engage. Because, like, for example, if I was a college student and I came to you and I said, I want to go to law school, then I'd be like, you need to talk to somebody else. But if you came to me and said, I want to be an ophthalmologist, I'm going to take you to lunch. I'm going to engage with you. So it's gaming. You know, you have no idea what you want to do with the rest of your life. You just know you wanted to go to medical school. So now this is the next step, talking to people, engaging with them. And there's a book, How to Make Friends and Influence People. That's one of the mantras, is to have people feel like you're interested in what they're interested in.
Awesome. Thank you all so much for that amazing insight. I am already very inspired just by listening to everything that I've heard. And again, for all of you who are listening, thank you all so much for joining us. Be sure to continue dropping your questions in the chat. We have another question. What is your advice for students who don't have a home residency program at their home institutions and are looking for mentors as a first year?
I would go and reach out to community physicians. For example, I'm in private practice and I have students come and shadow me. We own our own OR. So you can come in and shadow me in my clinics, especially during COVID when you can't do a lot of the away rotations. You can reach out to local private practice doctors.
Yeah, I would also echo by saying that, so if you do not have a home program, many other neighboring programs are usually very receptive to you reaching out with them, as well as trying to like schedule some type of away rotation with that respective program. So for example, I know at Meharry, they don't have a home ophthalmology residency program, but many of people who are at Vanderbilt Ophthalmology are very, very open to having the Meharry students go over and rotate with them. So I feel like that's definitely an option. And kind of the same thing we've been saying, yo, get plugged in with the NMA. If you don't have a home program, we will figure out a way to get you some experience and to get you to the right people.
And I think the other thing that you need to do is like stack your, especially if you're a first year, like be thinking about what these programs are looking for. They're looking for great board scores. They're looking for, you know, involvement, but more, other thing that's big is research. So one really big thing to get involved with, the sooner you can get your research out of the way, so that by the time you're a fourth year or a third year, you're not going to have to focus on that as much, because you can say, check, got all this research under my belt. Because you know, it's just something that these programs are looking for, because all these applicants are top tier and they're coming with, you know, publications and abstracts, all types of stuff, you know. So one of the things you can do to get your foot in the door is email somebody from one of these bigger programs and say, hi, I'm very interested in urology. I would love to get to know you. And if there's any projects that I can help you with, you know, obviously don't spread yourself too thin, because you're, you know, the big thing is you want to be focusing, especially as a first year, is learning about medicine and doing well in your clinicals and all that stuff. But research is a great way to open the door. People who love research always have opportunities. You know, it's putting a table together for a publication or looking up a review of topics, doing a lit search. They will put you on a paper, and then that's how you build your bridge to working with that person. So I think that that's a great way to, one, knock off the fact that, like, get rid of the fact that you have to do research. Just, all right, check, done that, and build these relationships with these people who are really interested in research. And from there, it's going to open the door to so many other things. So a lot of people who don't have home programs, you see research from all these big institutions because they've networked. And you can start in SNMA for all these people who went to these big name programs. They can introduce you to people, and that's how you get in the door. Or email them directly.
The other thing that I'll add to this is, you know, there's obviously a network of students who went before you. You know, there's people that they had to work with too. So, you know, unless it's like you're the first class of a school, which you might be, I don't know, they're making new schools every day, but use that network of people who have already graduated. See what community practice people they worked with, what research projects and what, you know, big name people that they were already involved with, and what relationships your school might already have. You know, you can tap into those resources as well. I think that's a great way to start. You know, look at the match list from the year before and see if you can reach out to that person who matched from your school, as a way to, you know, another way to, you know, make a route for you to get into the field.
Awesome. Thank you all so much. The next question was asking something similar in terms of how important research is for your individual fields. I think to expand on that question a little bit more, I was wondering if there are any particular field of research that people are engaged in. Do you see a little bit more of clinical work, basic work, any international work? How does that kind of work in your field?
Yeah, so I feel that for myself applying, because I was later in the game to discovering ophthalmology, I did not have a lot of ophthalmology research when I applied. So my first medical school, I did some research in cosmetic plastic surgery, and to an extent, that did pretty much relate to that ophthalmology. But I also considered urology when I was in medical school too. So I also had some urology research. And then when I did one of my away rotations, I went to Duke for my away rotation. Wonderful program, loved it. I wanted to take advantage of every single opportunity that was bestowed amongst me. So what I did is that, I saw a very interesting case in clinic, and then I went to my attending physician and I asked her, I was like, hey, like, this is a really cool case. Like, can I write it up? And within 2 days, I had a draft to her, and it was actually published as a case report. So with regards to research for me when it came to applying, although I did not have extensive ophthalmology research, I still had something to present. And I think that research just in general just shows that you're able to finish something that you pretty much had started. So during my interviews themselves, many people asked me about my research in urology. They asked me about my research in that plastic surgery. And in ophthalmology, they were a little bit more forgiving and understanding that most people who are applying to the field, they may not have that early exposure in comparison to other programs. So I feel like if you have some sort of research, that's good. Put it on your application, but absolutely be prepared to talk about it. And to kind of tie that off as well, we always talk about the step scores. We're always talking about the research scores. Am I competitive enough? But my biggest piece of advice to everyone here is do not give up on your hobbies. Do not give up on the things that truly make you human. For me, I'm a classical pianist of 20 years. I enjoy traveling. I enjoy food. I enjoy so many different hobbies that I was able to put onto my application. And I feel like those things in particular are what are going to make you stand out even more so compared to the research as well as the step scores.
For the research component, like my PhD was in cancer biology, had nothing to do with urology, really. I mean, the protein that I studied, I looked up some stuff before I interviewed and was like, I think I could relate this and maybe spin it like this and maybe do a project like this. That would be really interesting. But it really had nothing to do with urology. I think, like Dr. Dotson said, it's really your ability to talk about your work. Can you talk about, why you studied what you studied and what the results of what you studied and how it can possibly impact the fields or impact what you're doing. The goal is to see, can you take an idea and make a finished product? And if you're able to do that, that's pretty good. It doesn't have to be necessary. It's really great when it's in the field because that's awesome. But if it's not related to the field, the fact that you're able to still get a finished product out of something that you did and be able to talk about it so that it's relatable, I think that's actually more important than trying to do a project in the field, at least to me, in my opinion. But then again, I haven't been on the other side of reviewing applications, so maybe I'll have more detail in the years to come.
I can say from being I'm going to be on the side of reviewing applications this year, but like those things like your board score, your research, those are going to get you in the door. But I think that what, Dr. Dotson is saying is that your hobbies and what makes you you. And because at the end of the day, everybody we're interviewing because we think that you'd be a great fit for our program. But then it's like your personality, like what makes you you, how will you click with the other residents? Like that's what we care about. So we want to be able to have a conversation with you. And when you can talk about your hobbies and what you love to do, I think that's what came up the most, when I was in my interviews, is like, what am I interested in? What makes me me? What makes me human? When I'm, after a long day of call, what am I going to want to do? And I think it's really important that you stick to your hobbies and what makes you you, because in residency, you don't have a lot of time for you, but like you need to still have those hobbies that make you you so you can feel like yourself, So I think that's a very, very good advice.
Awesome. Thank you all so much. The next question is, how was the transition from being a medical student to a resident?
It's absolutely horrible.
Thank you for your honesty.
I'm sorry. We got an intern on here. We got 2 first-year residents that are trying to learn how to do surgery. And it is the most humbling period of your entire life. But on the other side, when you're done, I work 8:30 to 4:30. I'm on call 2 weeks from home throughout the whole year. I have never had to go into the hospital in the middle of the night. Nobody calls me except if they need their eye drops. So life is good on the other side, but when you're in medical school, they don't teach you how to do microsurgery. And so you have to learn all of that as a resident. At the same time as studying for exams, you have to take an exam every year. At the same time as studying for oral exams, we have an oral exam. At the same time as being on call, at the same time as like running a clinic. So it's horrible. It's a horrible existence. But on the other side is choice. And so what's happened is I think a lot of people are overwhelmed by that first hurdle. But, I see 40, 50 patients and I'm done at 4:30 every day. Like if it's 4:35, people start getting nervous. They're like, oh, Dr. Brown's still in clinic. So I just want to give hope to you residents because it's horrible. Oh, it's absolutely horrible. I'm sorry. That was too much from the heart and stomach. It was just
it's like you have like PTSD or something. It's like bringing back.
Bad. It was really bad.
Yeah, I mean, I think that med school, like you learn a lot of information. Residency, you have to like apply and adapt on a daily basis. Having difficult conversations with patients or just having to manage personalities, that is tough. But I think a big part of like what makes residency doable is going to the right program and finding the right people. Like I absolutely love the residents that I work with. I mean, we are one big happy family and we act like a family. I mean, sometimes we argue, we disagree, but it's not, we forgive, just like any other family and we move on, like you might not like your chief for the day, like, oh, they're making me do all this stuff. But then they, you look up to them and it's not a malignant program at VCU. Everybody is respectful. We are very helpful with one another. I help the interns. I remember what that transition was like. It absolutely sucked. I remember my first day on general surgery and I'm inheriting somebody who was there for 80 days and they're asking me to discharge them. I was like, absolutely not. Like, I don't know where to begin with this person's discharge with this EC fistula. What the heck is an EC fistula? Like, how do I manage that? Oh my God, like, they ask me, can you throw in Tylenol too? I'm like, I guess I can throw in a Tylenol order, How do I even put in the order on Cerner? I don't use that. We're getting Epic, thank God. But so many different things are running through your mind. Are you prepared for it? Yes, because you're a very hardworking person. As long as you are hardworking and organized, you'll be able to get through internia. You'll get through anything, But yes, I agree with Dr. Brown. I remember my first month, I was like, I don't know if I'm going to be able to do this. But here I am. Yeah.
I mean, I can talk to this as like a newly minted intern. The thrill is still there, I guess. It's only been 3 months. The first month was difficult. So, just a little background about me. Like I'm a wife and mother of 2. I started residency with a 2.5-year-old and a 4-month-old. So, it was a rough transition, having to get up. I live 30 minutes away from my hospital. Don't do that. So getting up at 3:30 to be in the hospital by 4:15 to pre-ground, because I needed a lot of time because I was rusty. I was on maternity leave for 4 months. I was like, what is this number that I need to write down? I's and O's, what are those? And so it just took me some time to get reacclimated to what was required of me as the student on. And as the intern, you really have to learn all of the patients on your service. And the chiefs and other residents are really dependent on you to, acquire the data so that they can analyze the data on rounds about what to do next with these patients. And so, just for the first month, just figuring out what my role was one of the hardest things to do. And it just took time to adjust. I mean, now that I'm 3 months in, is it still hard? Yeah, but is it easier than day one? Absolutely. And you kind of you're like fine wine. You just kind of get better over the year. And then it's going to, eventually somebody told me it's going to feel like breathing. Right now, I feel like I have asthma. I don't really think I'm breathing just yet. I'm still using my inhaler, but maybe my rescue dose is a little less nowadays, and it's going to get a little bit better towards the end of the intern year. Anyway, it's not that bad, y'all. You get through it, you adjust, and then it's like breathing, and then you start second year, and it's not like breathing anymore. So.
Yeah, so everyone on the call tonight, pretty much every intern July 1st is going to have some sort of story. My biggest piece of advice is if you feel anxious, if you feel nervous, if you feel like you don't know what's going on, best believe that almost everybody else around you is probably feeling the exact same way. They may not say it, they may be good at not showing it, but they most likely are feeling the exact same way. If you are currently in medical school and you are either preparing to do your sub-internship, your sub-by, please, please, please take that sub-by as seriously as possible. Really treat that sub-by as if you are July 1st intern ready to go. I want for you guys to learn how to put in orders, learn how to send pages, learn how to call family members, to call, communicate with nurses, everything. Because my sub-by was canceled because of COVID. So when I started my internal medicine rotations, it was definitely a very much so rude awakening for me. So if I could go back and really do things over again, that's something that I wish I would have done if my sub-by was around. So yes, y'all in medical school, please do take it seriously, because it will make your life as an intern so much easier.
I think the other thing is get help. So if you're in over your head, if you're exhausted, if you don't know what you're doing, get help. There are people there who will help you. Do not go isolated. If you're worried about a patient, tell somebody. You have the skill set to know if something's wrong or something's right. And you need to use that and tell people if something's wrong or something's right. So spread the responsibility. You don't want 3:30, 4 o'clock in the morning, somebody saying, why didn't you do this? Or why didn't you ask that? Spread it out. Tell everybody, tell the nurses, tell the family, tell anybody who's involved, so that you have open lines of communication.
Yeah, and one thing I'll say is go to a program where you feel comfortable calling up. Like when I don't know something, best believe I'm calling the PGY2 or the PGY3 on call to be like, hey, I've reached the level of my knowledge now. I need you to tap me out. And I think that that's really important. It's just like, when to make the judgment call to say, hey, this is something that I know versus something I don't know. And like when I'm on call at night, I cover different things. Like I'm in the TBF call pool, so I cover thoracic and vascular and, transplant. And, I didn't sign up to be those type of surgeons, but I just call up and say, hey, I reached the limit of my knowledge with this chest tube and I need help right now. And I think that just go to a program where you feel comfortable doing that and you find people who are like, yeah, absolutely, call me. And I think that was very clear from day one at UNC, like in the general surgery program and in urology, that they don't expect you to know everything. They just want you to get to a point where you can make sure this patient is stable enough for you to make the call. Or if they're not stable, figure out who needs to be in the room to kind of help you get to a point where you're like, okay, I can kind of step back from this. I'll be the person that throws in the orders and other people can take the lead on it. So you got to get to a point where you're comfortable doing that. You don't have to be the hero in medicine. And as the intern, you're definitely not going to be the hero.
And people are used to getting called. I think that's the other thing, is like, you think that you're like the only one. Everybody's calling them. So they know that when they're on call, they're going to get called. Me in private practice, people don't call me, but if you are university affiliated attending, that's why you signed up for that. That's the reason that you have that relationship. And not only that, I think the expectation is for you to call. So when you don't call, we get worried because we know that you're in deep water. So if you're not doing that, if you're not showing your humility, that worries me more. It worries me more when I have somebody that thinks they know everything, rather than somebody who's humble enough to know their limit.
Awesome. Thank you all so much. Oh, go ahead, Dr. Matthew.
Oh, I was just going to say, like, as a surgeon, you have to operate with caution. So if you don't have a caution button in the back of your mind, I was having a conversation today with my mentor because I was asking for feedback, and I was like, I'm just so afraid to put the semi-rigid in because you can hit someone's iliac. He's like, but you have to have a caution button, and that's with everything. So when I know it's scary to transition from medicine, medical student MS4 to intern, because you literally go from I graduated 2 weeks ago and I was an MS4 to now I'm the doctor. But as Dr. Brown said, and everybody has echoed, is like you don't have to know everything. I expect my intern to know nothing. Like Game of Thrones, you know nothing, Jon Snow. Just come to me. I'd rather them call me and say, Ashley, I don't know how to do this. Okay, let me show you. And then if they don't know again on the next time, okay, I'll show you one more time. By like the third time, we expect you to know, but not the first time. No one's asking you to throw a chest tube into someone's chest. Absolutely not. Do not do that. Call your upper level.
I think there's also, we have to bring up the imposter syndrome, right? So we have this whole like thing where we don't know if we really are supposed to be there or if they really think that we're awesome. And you just have to let all that go because you're dealing with a human being. And if it was your mother, if it was your brother, if it was your husband, wife, child, you would have that same attention to detail and that same fear. And so because we're righteous people, that's the reason we signed up for this. You have to tap into that. And I think a lot of times as Black folks, we underestimate our ability to kind of do this. And so we have a little bit of imposter, but I've trained residents. And there are some people that don't think that they're imposters and they do things that are in poor judgment. So I would rather someone think they're an imposter and go through the humility than somebody who thinks that they're ready to cut. So like the first 10 years of you practicing, you're learning how to do surgery. The second 10 years of practice is when you're learning how not to do surgery. So the whole idea is as a trainee, you're learning how to do surgery. You don't even know how to do surgery. And once you get into the field, that's when you're learning, okay, this is the person that I do not do surgery on, because you have the ability and the discernment to know which way to go. Because you have the practice, you've been taught to be excellent, more or less. And I think that's going to be resounding in all of the subspecialties, even though we're with urology and ophthalmology is better. I just have to get that in there somewhere.
Absolutely false. Absolutely false.
But I think it's the same concept that, we're here to help you. We're at every level, medical students, interns, residents. And once you get an actual job and once you buy your own Matthews practice urology, when you guys go into solo practice. And so we're here for you is the overall theme.
Awesome. Thank you all so much. We've got a couple more minutes left here. One question that I had was with regards to looking at potential programs to do residency. What are some of the most important things to look at, and how do you go about actually finding the information that you're looking for? I think sometimes people aren't as brutally honest as they can be about the things that go on in the background in the program. So how do you go about actually finding the information that you're looking for?
So for ophthalmology, some people will say take this with a grain of salt, but we do have like our Google spreadsheets that are available online that have information from a few years prior. For me personally, I wanted to go to the program that was going to make me into the best surgeon possible and that was going to send me to whatever fellowship I wanted to go to. And that's the main reason why I chose to go to the University of Iowa. In ophthalmology, if you go to a larger city like a Chicago, like a New York City, you're competing against 5 or 6 different programs. So your surgical numbers are going to be significantly diluted. Here at Iowa, our closest program is Mayo in Rochester, Minnesota. So we have some of the highest surgical numbers in the country. It's an honor to be one of the highest ranked programs in the country. And when you look at our graduating residents and such, they're going off to the best fellowships. And they're often commented and said that they are some of the best surgeons that they are seeing. So those are a few reasons why I chose to come to Iowa. And those are some things that I would personally keep in mind if you're looking into ophthalmology programs.
I would say so this is kind of like a question I got in my interview a lot. It's like, why would you come to our program? Or, one of my favorite things to say, like, I love Peloton. So for people who like Peloton out there, Tune Day says, I give you the ingredients for the ride and you season to taste. I feel like for all the urology programs, there's no real bad urology program. They're all going to give you the ingredients. You just have to like season it to your taste. So for me, it was a program that was, I'm a mom, so I wanted something that was family friendly, and, supported their residents. I wanted something that had a lot of research opportunities, and then I wanted something with a strong surgical volume. And I found that at UNC Urology. One of the videos that they released last year was using the Full House themed music, and somebody had like a urology book in a stroller. I don't know if that was Saul, one of the chiefs right now, but it was like a video that I was like, what, I could relate to this. And then talking to people who went to the program, they talked about how much they support, your wellness and well-being. We have wellness days. They were doing yoga during the interview. I was like, yoga, that's wellness, right? For some people at least. And, I just felt like those are the things I was looking for. You got to figure out what you want. Some people want a hardcore surgical program that, you're going to operate day in and day out, and it's going to be like a really tough life, but maybe they match really well after fellowship. I was like, UNC matches well out for fellowship, and they still have a well-being, and they care about you as a person. And I think you just have to kind of figure that out by talking to other people who have been to those programs. Take some people's advice with a grain of salt, but if you keep hearing the same theme about the same program and you're like, it's a negative theme, maybe you don't want to go there.
I mean, I would agree. That was a lot of the reasons why I went to VCU. It's a great culture. I didn't want to go to a place where I was afraid to talk to my attendings. Like my attendings are super open. You can call them. It doesn't matter if you're the intern calling them. They treat you the same way that they would probably treat the chief. They don't expect you to know much, but like they're not rude when you call. If you run a consult by them in the middle of the night, they're not barking at you. I didn't want that. And I got that culture from listening to the interview. That is a really big thing. I know it's hard being virtual, but I remember going to some interviews and I was like, heck no, I'd rather not match than to match at this program. Yeah, there were some places I did not rank. I was like, oh, heck no, I would never. I'd rather not. Yeah, it's a big thing to think about. Like, would you rather not be a urologist and match this year, or ophthalmologist or whatever surgical subspecialty you're matching into? Then go to this program. It's not worth it to me. I'm not going to go to a program where I saw people, I went some of my OA programs, I felt that way. And so it was looking at how the people interact with each other. At VCU, sometimes when we're doing these interviews, we forget that we're interviewing because we're like talking to one another. Are the residents talking to each other and interacting with one another like they're happy? I mean, sometimes we forget when we're doing these open house things that we start laughing and joking because we forget people are there and we're like, oh, maybe we should behave ourselves. But no, like this is how we are on a daily basis. And I wanted that. I wanted that culture where you feel supported, and I feel very supported by my attendings. And the other thing is being a woman and a minority, I didn't want to feel like I could feel that I'm Black at my program. I mean, there were some programs where I felt like I would just know that I am sticking out like a sore thumb. I never feel that way. My chair is super supportive. My PD, everybody is great. I never even think about my race or being a woman in urology. They treat me like any other surgical resident, and they hold me to the same standard as everybody else. And I don't feel any different. Even across the general surgery rotations I did last year, I never felt anything like that. And you just get that sense I got that sense from my interview, and I hope that you all get that too, but you got to pay attention to context clues, and that's what I did.
All right, awesome. Thank you all so much. We are nearing the end of our program. And to wrap up, do you all have any words of wisdom, encouragement, advice for those of us who are joining us tonight?
All right, I guess I'll go first. My favorite thing to say, like I said already, is get yourself a sponsor. Get you that person who's going to talk about you behind closed doors, who's going to help move you to the next level, who's just making moves, just secretly on your behalf. You don't even know what's going on, but they want the best for you because they can see the best in you. It's not enough for them to just be like, oh, I'll just read your application and give you like grammar changes and, you know, that stuff. Like that stuff is great too. You need those people, but you really need to find that person who's going to really, you know, see the potential that you have, like more than what you even think you have, and really boost you in the background, because these fields are so small. Everybody talks to each other, you know. It's just, you got to find that person. So take the initiative, make, you know, new waves, talk to people, you know, put your best foot forward, be ready to interview everybody, like be interview ready every time you talk to somebody at a different program, so that you can, you know, really put your best foot forward, and these people will talk about you behind closed doors. I think that's the best advice I have to give.
All right. I guess.
Go ahead, Aaron. That's fine.
All right. So I guess my only piece of advice I would say is continue to be yourself, put your best foot forward, and show your passion and your love for whatever specialty it is that you go into. If you talk about your specialty and if you just light up, if you are showing your passion, if you are showing how much you love the specialty, there are people that are going to be around you who are going to make a way for you to match into the program that you're wanting to go to. And just honestly, just be yourself and have fun when it comes to the residency interviews. I enjoyed my time when I was interviewing for residency, and I mean, I'm very grateful and I'm very happy at the place that I'm at right now. So do know that, you know, wherever it is that you end up, know that it truly is meant to be.
I was gonna say, don't give up. You know, I know that's very cliche, but like this road is really long. You know, if you don't match, try again. Not, we want you all to match, trust me, and you all have the ability to do so. But just because you didn't match the first year, what you need to do is like attack your weaknesses, whatever that is in your application. You know, what can you fix? What can you change? What can you strengthen? How can you do better? Is it your interview skills? Get an interview coach. You know, invest into your future, because like you just have to never give up and just try to enjoy the ride. It's as hard as it is, it will happen if you believe it and you really want it. It will happen. You just got to make the right connections and believe that you are very capable of succeeding and being the type of specialist that you want to be. So that's my biggest advice, is just keep going, because at some point it's going to happen. You got to be ready when it happens.
I would echo that and say just keep showing up. So there's going to be challenges, but you just got to keep showing up. Thank you to the SNMA, and definitely reach out to us. We're here for you guys.
Awesome. Thank you again to our amazing panelists. We appreciate your support of the SNMA and of our membership. All of our Sowing Seeds webinars are recorded and can be found on our SNMA Facebook page. For those of you in the audience, follow us on Instagram at SNMA Official, at SNMA on Twitter, and like us on Facebook. But most importantly, if you're not yet a national member, please visit snma.org to sign up and get connected. Thanks for tuning in.